already 5 o'clock. Where is Bakis? I don't know.
Hello guys, sorry I'm late. Okay, sorry. Okay, so what is the assignment topic that Dr. Dan give to us?
Oh, we are looking for the treatment of the anaphylactic in the Google.
Oh, anaphylactic shock. I have experienced that before. That time I have rashes and difficulty in breathing. That was so terrible.
Oh, really?
Can you tell us more about it? Let me tell you the story. Hey Wawa, what are you doing in my apartment?
Nothing, just lepak-lepak here.
Can I have that?
Eva, that's my bread! Give back.
Wait a minute. What did you put in this bread?
Oh, just peanut butter. Why? What's wrong? Have a seat. But, are you okay? What happened to your face? What? I don't understand. Lisa, can you help me?
Yeah, what's wrong with her?
I don't know, she just ate the bread and there's a little fell off.
Go, find her medication now.
Okay.
Where is her medication?
Which one is the one? Okay, is it this one?
No. Oral cannot be given to unconscious people. Where is the pen?
Pen? You mean this pen?
No, the EpiPen.
EpiPen? Oh, you mean this one? Here's the pen.
Okay, thank you. Now you call the ambulance.
Okay, hello?
That time I use EpiPen. EpiPen stands for epinephrine.
But how can epinephrine be used to treat anaphylactic shock?
So let's go find about it.
Hey guys, look here. I found something interesting. It's about how epinephrine was discovered. I think it's better for us to know the history first, right?
Yes.
Discovery of epinephrine. It all started when asthma became a problem since ancient Egypt and also recognized as a respiratory problem by Hippocrates in 450 BC. In 1859, Henry Salter reported that sudden alarm or excitement can relieve asthma, which shows that the endogenous substance can give therapeutic effect. In 1894, George Oliver and Edward Schaefer did an experiment on the potent effect of adenomedulla extract on heart rate and blood pressure of animals. The result shows increase in both heart rate and blood pressure. In 1899, John Jacob Abel made an attempt to obtain pure extract of the endogenous substance, which he claimed as epinephrine, based on previous work by Oliver and Schaefer. However, the extract was not pure. In 1900, Jokichi Takamine succeeded in isolating the pure, stable, crystalline form of epinephrine, which he named as adrenaline. In 1901, the empirical formula of C9H13NO3 was soon determined by Aldrich, and the purified product was quickly patented by Parke Davis Company. In 1905, after the establishing of pure adrenaline or epinephrine, more research was done towards therapeutic use of the drug. It was discovered that epinephrine can cause bronchodilation, which helps to relieve asthma attack. Since difficulty in breathing is one of the anaphylactic shock symptoms, epinephrine was proved to be a useful treatment to counter anaphylactic shock and still being used till today.
So that's how it was discovered. Oh, I see. But there are several drugs can treat anaphylactic shock too. Why epinephrine become the drug of choice? Why?
Where?
That's fine for that.
Bingo! I found a video that can answer all our questions. Look!
What is anaphylactic shock? The terms anaphylaxis and anaphylactic shock are often used to mean the same thing. They both refer to a severe allergic reaction. This severe reaction happens when an over-release of chemicals put the person into shock. Shock is when your blood pressure drops so low that your cells don't get enough oxygen. The most common triggers of allergic reaction are food, medication, latex, and insect sting. So, what are the causes that lead someone that have severe allergic reaction to get anaphylactic shock? During an anaphylactic reaction, immediate release of a series of mediators including histamines, leukotriene, prostaglandin, thromboxane, and bradykinin from basophil and mast cell cause several reactions to the organ. The first one is bronchoconstriction. This will lead to airway and breathing problems. The second one is vasodilation, caused by relaxation of smooth muscle cell in artery. The blood flow will increase due to a decrease in vascular resistance. This leads to the cardiovascular collapse and immediate decrease in blood pressure. To treat anaphylactic shock, we need a drug that can antagonize its causes. So, the drug that is appropriate to treat anaphylactic shock is epinephrine. Why epinephrine? It is because from many drugs that are available, there are no other drugs that can act as an agonist on all adrenergic receptors as epinephrine. The ability of epinephrine to treat many signs of anaphylaxis in short time is important because this short is life-threatening. The effect of epinephrine. The first one is vasoconstriction. The second one, it increases the heart's contraction and heart rate. The third one, it prevents the release of additional allergic chemicals. The fourth one is bronchodilation. So, let's find out more about epinephrine and how it actually works inside the body.
There are four functional groups that are important in binding to the receptor. The first one is phenyl. Phenyl hydrogen bond to the receptor. The second one is alcohol. Alcohol hydrogen bond to the receptor. The third one is amine, which is primary or secondary only, involved in ionic bonding to the receptor. The fourth one is aromatic ring, involved in one-divorce interaction.
Epinephrine is a direct-acting full agonist for the overall adrenergic system. It can interact with both alpha and beta adrenergic receptors, including the subtypes such as alpha 1 and 2, beta 1, 2, and 3. Extra hydrophobic pocket in beta adrenoceptor offers selectivity towards the receptor. However, epinephrine does not have extra alkyl group and an alkyl substituent, so it's not selective. Epinephrine is fast-acting, but it has a short duration of action and rapidly cleared from the system. So, the question arises, why? Epinephrine rapidly inactivated, mostly in liver, because of methylation by catechol O methyltransferase and form inactive ether, which is epinephrine. Epinephrine acts on beta-1 receptor at heart that cause increased heart contractility, increased heart rate, increased cardiac output, and increased blood pressure. It also acts on alpha-1 receptor at blood vessel and cause vasoconstriction, increase of total peripheral resistance, and increased blood pressure. Epinephrine also acts on beta-2 receptor at smooth muscle of bronchioles. It will promote bronchodilation via smooth muscle relaxation and increase respiratory rate and oxygen supply.
Pharmacodynamic of epinephrine. Firstly, epinephrine acts as vasoconstrictor through alpha-adrenergic stimulation. Second, epinephrine acts as bronchodilator by stimulating bronchial beta-adrenergic receptor. Pharmacokinetics. For absorption, the intramuscular administration is rapid onset of action and the plasma half-life is about 2 to 3 minutes. For metabolism, epinephrine is rapidly inactivated in the body, mostly in the liver, by enzyme catechol O methyltransferase and monoamine oxidase. For elimination, epinephrine is excreted as metabolics in urine.
Main clinical indication of epinephrine. Based on the mechanism of action that has been explained before, epinephrine able to have several therapeutic indications. First and foremost, epinephrine is used to treat a number of conditions including cardiac arrest and superficial bleeding. Historically, it has been used for bronchospasm and hypoglycemia, but there are newer treatments for these conditions that are selective for beta-2 adrenoreceptors, such as salbutamol, that are currently preferred. Epinephrine also known as a drug of choice for the treatment of acute asthma, as epinephrine will relieve respiratory distress due to bronchospasm. It acts as primary drug that used in the emergency treatment of respiratory conditions when bronchoconstriction has resulted in diminished respiratory function. Next, it is used to prolong the action of local anesthetics, presumably by decreasing the local blood flow through the action of vasoconstriction at the site of injection. Besides, it also been used as a topical homeostatic agent on bleeding surfaces such as in the mouth or in bleeding peptic ulcers during endoscopy of the stomach and duodenum. Inhalation of epinephrine may also be useful in the treatment of post-intubation and infection screws. However, the main clinical indication of epinephrine is actually anaphylaxis, where it occurs through the stimulation of alpha-adrenoreceptor. So, it becomes a drug of choice for the treatment of type 1 hypersensitivity, where it provides rapid and emergency relief in response to allergen.
Now, we move on to the adverse effect of epinephrine. Epinephrine can cause several unwanted side effects to the central nervous system, respiratory system, and cardiovascular system. For respiratory system, one of the adverse effects of epinephrine is pulmonary edema. Pulmonary edema occurs when there is increase of heart rate and systemic resistance cause the excess load on the left ventricle. Later can cause pulmonary congestion. This is accompanied with mismatch in increased pulmonary artery pressure compared with pulmonary alveolar pressure, causing hydrostatic flux of fluid. For cardiovascular system, the side effect of epinephrine usually occur to the people that associate with hyperthyroidism. People with hyperthyroidism will more sensitive toward sympathomimetic drugs such as epinephrine due to the elevated levels of thyroid hormones in their body, cause unwanted effects toward cardiovascular systems such as tachycardia and hypertension. As for central nervous system, the side effects include anxiety, nervousness, headache, tension, tremor, and stroke.
That's why. Oh, this is a video. I must subscribe.
Assalamualaikum.
What you do right now is already Isha.